Do you ever notice clear, watery fluid leaking from a cut or a wound that just won't stop, even when the wound looks like it should be healing? Or maybe you've had swelling in your arms or legs that feels heavy and strained. These could be signs that something's up with your body's drainage system. That's where lymphorrhea comes in. Imagine your body has tiny rivers called lymph vessels that carry a clear fluid called lymph to remove waste and fight infections. When one of these rivers breaks and leaks, it's called lymphorrhea, also known as lymph fistula. It's like a garden hose with a hole, fluid drips out, and things start to go wrong. It's not common, but when it happens, it needs attention. What causes this leaking hose effect? Usually, it's damage to the lymph vessels. Think of a time someone had surgery, especially in the neck, groin, or underarms, like during cancer treatment. For example, if someone has breast cancer and gets lymph nodes removed, the lymph flow can get disrupted. This is like rerouting traffic without road signs, chaos. Trauma, like a deep injury from an accident, can also break these tiny vessels. Infections or tumors pressing on the vessels are other causes. Rarely, even birth conditions may lead to leaks. So most often, it's not something you did wrong. It's often due to medical procedures or injuries that affect your body's plumbing. So, how do you know if you might have lymphorrhea? The biggest clue is a clear or milky fluid oozing from a wound or even through the skin, without an open sore. Let's say you had surgery a week ago, and now there's sticky, watery fluid draining from the incision site. That's a red flag. The area might swell, feel heavy, or get tight. Some people say their clothes feel tighter on one arm or leg. Others notice skin that won't heal or feels cold. And because lymph carries infection fighters, losing it means you might get infections more easily. If you're constantly catching colds or your cuts get infected fast, your body might be losing too much lymph. How do doctors figure this out? First, they'll ask, is fluid leaking? Where from, after what injury or surgery? Then they may test the fluid. Real lymph is usually clear or milky, and tests high in a substance called protein. Imaging tests like a lymphogram, a special X-ray with dye, can track the leak. It's like finding a broken pipe in your house, using food coloring in the water. Treatment depends on how bad it is. Mild cases may heal with rest and special bandages that squeeze the area, compression wraps. Doctors might say, avoid lifting heavy bags, drink lots of water, and let your body fix itself. If it's serious, you might need a procedure to plug the leak, sometimes with glue-like medicines or surgery. Nutrition matters too. Eating well helps the body patch things up. Can you stop lymphorrhea before it starts? Not always, but you can reduce your risk. After surgery, especially if lymph nodes were removed, follow your doctor's care guide like a rule book. For example, if they say don't use that arm to lift heavy groceries, take it seriously. Keep wounds clean and dry. Use gentle skincare to avoid cuts or infections. If your arm or leg swells, wear compression sleeves like athletes do, but prescribed by doctors. Think of it as wearing a support suit for your lymph system. Stay active but not too hard. Walking helps fluid move without straining. Basically, treat your body like a fine-tuned machine. Give it care, rest, and protection. Scientists are always looking for better ways. Recently, doctors are using special dyes and cameras during surgery to see lymph vessels in real time, like turning on headlights in a dark tunnel. That way, they avoid damaging them. New glues and clips can seal leaks without big surgeries. There's also exciting research on lymph node transfer, moving healthy nodes to help rebuild the system, kind of like replacing broken internet cables with new ones. Some studies are testing drugs that help vessels heal faster. While still growing, these advances give hope that one day, lymph